Hi, I'm Dr. Aaron Filler, Medical Director of the Institute for Nerve Medicine. What a difference a few years makes. Until recently, most doctors had never heard of piriformis syndrome, much less be able to diagnose their patients with it. And for good reason. Piriformis syndrome is a complex neuromuscular disorder featuring compression or even damage to the sciatic nerve. In the past, patients who suffered from piriformis syndrome usually received a diagnosis of sciatica, a catch-all phrase to describe their radiating pain extending from the buttocks down the leg to the foot. Symptoms can range from tingling and numbness to outright pain that makes sitting for any length of time almost impossible. Today, however, piriformis syndrome is much better known in the medical community due in large part to advances in medical imaging and diagnostics, including magnetic resonance neurography. In fact, it's now possible to pinpoint the exact location of a patient's nerve condition using MR neurography and to conduct minimally invasive surgery that effectively treats the piriformis syndrome in a single procedure. Then why are so many piriformis syndrome cases not properly treated? Unfortunately, it's still common for many doctors and insurance carriers to use ineffective imaging and treatment strategies with piriformis syndrome. Some of these include a 3 Tesla MRI of the patient's pelvis not adequately tuned for the nerve or the muscle involved, followed by a series of spinal injections that completely miss the location of the nerve problem. CT or fluoroscopy-guided injections that bombard the patient's pelvis with dangerous X-ray radiation, yet never identify the nerve problem location. Even worse, high doses of X-rays can lead to issues with a man's prostate or a woman's fertility. It's something you'll want to avoid. And finally, ultrasound-guided injections. Yes, they offer zero radiation, but they are completely ineffective when it comes to accurately identifying the nerve locations that are needed to evaluate these conditions. The best you can hope for is relief in the general area, but results are typically poor. So what do all of these ineffective strategies have in common? They rely on imaging technologies that insurance companies love, but simply cannot accurately depict nerve tissue. So why do they recommend them? Because they're the lowest cost option because they're available for other problems. Insurance companies are in a business that's about making money, of course, and when they have a choice between 2 medical treatments, they'll usually go with the lower cost option. Unfortunately, none of these lower cost options, including CT, fluoroscopy, and ultrasound, can provide the level of detail necessary to treat a piriformis syndrome. So, many patients undergo one treatment after another without a permanent solution to their pain. It's not uncommon for us to hear, but I've already had a dozen injections. That's when we tell them their previous procedures were under the medical imaging systems that had no hope of accurately identifying the location of their nerve pain. It's vital that the physician be able to see the soft tissue injury, the nerve entrapment, the vascular anomaly, and all the pain generators in real time if a successful outcome is to take place. That's why, for effective treatment of piriformis syndrome, leading physicians trust magnetic resonance neurography and open MR operating environment where they can use real-time imaging to treat the exact location of the nerve problem. Before MR neurography, traditional piriformis surgery carried a significant risk of nerve injury. Surgeons had to approach the nerve through the muscles, and many patients were left with permanent difficulty walking or running. Success rates were quite low. Today's technique employs a safe, minimal access approach with excellent proven results and a short recovery time, in some cases as quickly as a few days. In the past 15 years, I have conducted more than 2,500 minimal access piriformis surgeries with excellent results. Patients ranging from athletes and dancers to everyday professionals have returned to their usual activities with great success. My surgical strategy focuses on working in parallel with open MR guided injections. The procedure takes place under a specialized MRI machine that features an open design. This allows the surgeon to work on the patient while conducting real-time scans to help guide the injection needle to the exact location. This strategy produces excellent results with medication delivered precisely to the correct nerve tissue. Rather than flooding a general area like many unsuccessful treatment strategies, open MR guided injections are accurate and effective. When you're considering piriformis surgery, it's important to choose your surgeon carefully. You want one who uses the latest medical imaging techniques to pinpoint the location of your problem, and you want a surgeon whose experience level is high as possible in case there are special surgical challenges in a given case. Here's a good example. One of the biggest challenges in treating piriformis syndrome is the fact that nearly 15% of the population has a split sciatic nerve and a split piriformis muscle where part of the nerve actually passes through the muscle. In these patients, traditional injections typically fail, and invasive surgery is very dangerous. By choosing a surgeon who relies on MR neurography scan studies in advance, your specific set of conditions can be determined before the surgery takes place. Then, using open MR guided injections, your surgeon can treat both areas accurately and effectively. As a result of doing thousands of these surgeries, I have developed reliable methods for achieving successful outcomes when dealing with split muscle and split nerve situations. Our clinical treatment case histories have shown that open MR guided injection is the most accurate method for diagnosing and treating piriformis syndrome by a long shot. We combine this modern treatment strategy with muscle relaxants and scar-dissolving agents like hyaluronidase and Hylenex, as well as nerve lubricating substances such as Restylane. One strategy we sometimes employ for difficult problems is the use of Enbrel. We do this as part of a 1-month treatment regimen to reduce neuritis inflammation that occurs postoperatively in some patients. By giving Enbrel via open MR guided injection, the chances of a successful outcome are increased. Prior to performing an invasive treatment like piriformis surgery, we encourage our patients to try common remedies like massage treatments and yoga. Many patients report relief when combining these exercises along with dietary changes like eliminating gluten or adding vitamin B supplements. Now, when we do perform piriformis surgery, we sometimes also use open MR guided injections during the postoperative period. Doing so breaks down scar tissue and prevents muscle spasms. This strategy aids the recovery and optimizes the chances of a successful surgery. And finally, our experience has shown that patients who have bilateral piriformis syndrome, where the problem is found on both sides of the body rather than just one, in these patients, both sides can be treated in sequence during a single surgical operation. If you think you may be suffering from piriformis syndrome, talk to your physician. Only a trained professional using the latest in medical imaging techniques can accurately diagnose piriformis syndrome. During surgery, the use of complex intraoperative electronic nerve monitoring technology adds yet another important dimension to the safety and accuracy of modern advanced neurosurgical operative treatment of piriformis syndrome. It's common these days to do our own research on possible symptoms. That's okay. Investigating medical conditions and their possible treatments is one of the best things about the internet. But it's important to remember that piriformis syndrome is a variable diagnosis. Not every patient has the same symptoms nor the same treatment strategies. What works for one person may not be appropriate for another, yet they both suffer from piriformis syndrome. Before you attempt any treatment strategy, consult your doctor. Only he or she can order an MR neurography scan study to accurately determine if you have piriformis syndrome. And if you've already had one or more injections without relief, ask your physician to refer you for an MR neurography scan study to pinpoint the location of your problem. If you're considering surgery, be sure that you see an experienced surgeon who uses modern electrodiagnostic surgical methods for piriformis surgery. If you're planning to have a piriformis injection, make sure it's an open MR guided procedure. You can overcome your piriformis syndrome thanks to MR neurography, open MR guided injection techniques, and innovative minimal access surgical techniques. Talk to your doctor today.